Hi everyone, and welcome to our module on RNA viruses. I've written on this slide the names of all of the RNA viruses in the RNA virus families, and they are a big group, and I've split them up in some very specific ways to help you keep them all straight. So the first division I make is between those that have a negative sense RNA genome and those that have a positive sense RNA genome. All of the RNA viruses with a negative sense genome have a helical capsid, and all of the RNA viruses with a positive sense genome have an icosahedral capsid. There's just one exception to this rule, and that's the coronavirus family. They have a positive sense genome, but they have a helical capsid, and I've written that one exception down here. All positive sense RNA viruses are icosahedral except for the coronaviruses, which are helical. After dividing them up by those that are positive and negative sense, I then divide them up by whether or not they have an envelope or not. So all of the helical viruses are enveloped, and the ones that are icosahedral can have either envelope or they can be naked. There are some other important rules of thumb that I've written in this box down here at the bottom of the screen. All of the RNA viruses are single-stranded except for the reoviruses, which are double-stranded. I'm circling those right now. They're an unusual group. They have double-stranded RNA for their genome. All of the RNA viruses replicate in the cytoplasm except for the influenza virus and the retroviruses. So these are the retroviruses right here. This group includes HIV. And down here are the orthomyxoviruses, and that group includes the influenza virus. All of the RNA viruses have a linear genome except for three groups, and they go by the mnemonic BAD. So the Bunya viruses, the arena viruses, and the delta viruses, which include hepatitis D, all of these have a circular genome. And then finally, all of the RNA viruses have a non-segmented genome except for four groups which go by the mnemonic BOR. So those are the Bunya viruses, the orthomyxoviruses, that's the O in BOR, the arena viruses, which are right here, and finally the reoviruses, which are up here. Those are the four families that have segmented genomes. So what I'm going to do in this module is go through these in groups. First I'll talk about the naked viruses, then I'll talk about the positive sense envelope viruses, and finally the negative sense enveloped viruses. So the first group I'm going to talk about are these naked viruses up here. And one thing to know about these viruses is that in general, naked viruses are more durable in the environment. So you can find them out in nature. They're often transmitted fecal orally, and they are very stable structures, and that's why they're transmitted that way. The envelope viruses, like these groups here, are less stable in nature. So they're more often transmitted by a mosquito bite, for example, or sexual transmission, or in aerosolized droplets. They don't usually get spread around out in the environment like these naked viruses up here do. Let's start by talking about the calicivirus family of viruses. All of these viruses are non-enveloped. They all have a positive sense single-stranded RNA genome that is linear with an icosahedral capsid. And the main member of the calicivirus family that causes disease in humans is called norovirus. It also goes by the name Norwalk virus, named for Norwalk, Ohio, where the infection was first described in the 1960s. And if you get an infection with Norwalk virus, you will develop viral gastroenteritis. So remember that most of the gastroenteritis you will see clinically is viral. Bacterial gastroenteritis is relatively rare. So people with Norwalk virus infection have 2 to 3 days of watery diarrhea along with nausea and vomiting. And remember, this is a non-inflammatory diarrhea. The virus does not invade the mucosa and cause inflammation. So the diarrhea will be non-bloody with no mucus and no fecal leukocytes, especially if you send a stool sample to the lab. Norovirus is transmitted fecal orally. Remember, most of these non-enveloped RNA viruses have fecal oral transmission because they are very durable in the environment. Often people get the infection from eating contaminated seafood that was swimming in dirty water contaminated with the feces of people who had this infection. Norovirus has a very low infectious dose. It doesn't take many virus particles to make you sick, and it's shed in the stool for several weeks after infection, and that's why it can infect a lot of people once one person gets the disease. For this reason, it commonly causes outbreaks. So school-age children will have an outbreak run through their school. People on cruise ships have been described as having outbreaks, and people in hospitals and nursing homes. Usually the diagnosis is made clinically, and there's no specific treatment. The next virus family is the hepivirus family, and the most important member of this family is the hepatitis E virus. These are non-enveloped viruses with a positive sense single-strand RNA genome that's linear and icosahedral, very similar to the caliciviruses. And I talk about hepatitis E infection in detail in the module on viral hepatitis, but I just want to point out here that this virus is also transmitted fecal orally, and that should make sense to you because it's a member of this group of RNA viruses that do not have an envelope and that are very sturdy in the environment. The next family of viruses are called the reoviruses, and they get their name from the letters REO, which stands for respiratory enteric orphan viruses. When this family was first discovered from respiratory and enteric tracts, they were not known to cause any human diseases. Therefore, they were named the respiratory enteric orphans, or reoviruses. They're now known to cause a couple of human diseases. All of these are non-enveloped viruses. They are unique among the RNA viruses in that they have double-stranded RNA for their genome, and they have an icosahedral capsid. Another unusual feature of the reoviruses is that they have a segmented genome. Their genome is made up of 11 segments of RNA, and this is one of 4 families that has segmented genomes. And they are a linear virus with linear RNA in the genome. All of the reoviruses contain an enzyme inside the virus particle called RNA-dependent RNA polymerase, and they need this because there is no enzyme inside of human cells that can make mRNA from double-stranded RNA. The 2 medically important viruses in this family are the cultivirus and the rotavirus. The cultivirus is a relatively uncommon virus that causes an illness called Colorado tick fever. This is an illness people get when they get bitten by a wood tick in the Rocky Mountains. The wood tick is called Dermacentor andersoni, and it lives in rodents like squirrels and chipmunks in the Rocky Mountains, and then the wood tick can transmit it to humans. People who get infected have fevers and chills and myalgias and headaches, and it's usually a self-limited infection. And then the second reovirus is a more important virus, and this is the rotavirus. Rotavirus causes gastroenteritis in children. It's transmitted by the fecal-oral route, and as I said before, many of these non-enveloped RNA viruses are transmitted fecal-orally because they are relatively stable in the environment. The virus infects mucosal cells in the GI tract, and it leads to excess secretion of fluid and electrolytes, and as a result, the child will develop watery diarrhea. There'll be no blood or mucus, and there'll be few or no fecal leukocytes. You can diagnose it by finding the virus in the stool. There are a number of techniques available in the microlab to do this, and there is a vaccine for rotavirus. It's an oral vaccine. It's a live attenuated version of the virus, and this is given to children prior to 6 months of age to try and decrease the likelihood that there will be outbreaks of rotavirus. The next family of RNA viruses is called the picornavirus family. There are 5 medically important viruses in this family: poliovirus, echovirus, rhinovirus, Coxsackie virus, and hepatitis A. And if you take the first letter of each of those 5 viruses, it spells the word perch, which is how many people remember them. All the picornaviruses are non-enveloped. They all have a positive sense single-stranded RNA genome that is linear with an icosahedral capsid. A unique feature of all the picornaviruses is that they synthesize a large polypeptide which then gets cleaved into a number of smaller functional viral proteins. Most of these are transmitted by the fecal-oral route. They are called enteroviruses because the way they get into the body is through the GI tract. The one exception is rhinovirus, which causes the common cold. Rhinovirus likes to infect the nose and pharynx. The word rhino means nose. That's an easy way to remember that. And this is the one picornavirus that can't survive in the stomach. It is what's called acid labile, which means it does not tolerate the acidic stomach environment. So rhinovirus has a different way of being transmitted. It's not fecal-oral. It's transmitted directly from person to person via respiratory droplets. Now let's talk about each of the picornaviruses in a little more detail, and the first one is poliovirus, and this is the virus that causes polio or poliomyelitis. This is a febrile illness followed by characteristic weakness and paralysis, and I talk about the symptoms of a polio infection in more detail in the neurology modules. You will rarely see polio in the modern era, and that's because of vaccination. There are 2 vaccines that are used to vaccinate people against polio infection. The first one is called the inactivated poliovirus vaccine, or IPV. It's sometimes called the Salk vaccine, named after its creator. The major advantage of this vaccine is that it's a killed virus, so it cannot cause a vaccine-associated polio infection. This is the only vaccine used in the United States, and it's the preferred vaccine in developed countries. It's an injected vaccine, and therefore it generates a systemic antibody response. So it's largely IgG antibodies that get synthesized in reaction to injection with the Salk vaccine. Contrast that with the other option for vaccination, which is a live attenuated oral polio vaccine. This is sometimes called OPV, or the Sabin vaccine, also named after its creator. This is an attenuated virus, so it's weakened, but it's still alive, and you take it by mouth. This has some advantages in the developing world. It's very inexpensive and it's easy to administer because it's taken orally. In addition, you will shed some of the attenuated virus in the stool, so there will be fecal-oral transmission to some of the people who are unimmunized. So by immunizing a few people, you may potentially immunize many more of their close contacts. A key distinction between the attenuated oral polio vaccine and the injected vaccine is that the oral vaccine triggers local immunity in the GI mucosa. It is going to be largely a IgA antibody response as opposed to the IgG antibody response that you are going to see with the injected vaccine. And then, as I mentioned before, a major downside to the attenuated oral vaccine is that it can potentially cause vaccine-associated polio, and you can't give it to people with immunosuppression. And that's why in developed countries, this is the major vaccine that is used, but this one is still sometimes used in developing countries with limited resources. Some of the other members of the picornavirus family include echovirus, and the most important thing to know about this virus is that it can cause aseptic or viral meningitis. You should know that 90% of cases of viral meningitis are caused by two picornaviruses, either Coxsackie virus or echovirus. Hepatitis A is also a picornavirus, and I discussed this virus in detail in the modules on viral hepatitis. For our purposes here, just let me point out that it is a non-enveloped RNA virus, and just like many non-enveloped viruses, it is sturdy in the environment, and that can help to remind you that hepatitis A is transmitted fecal-orally and often picked up from drinking contaminated drinking water. Rhinovirus, as I said before, is the one picornavirus that is not fecal-orally transmitted. It causes a viral upper respiratory infection. It is the most common virus associated with cold symptoms. The last member of the picornavirus family is Coxsackie virus, and there are two subgroups of Coxsackie called Group A and Group B, and they can cause a number of different infections. Both Group A and B Coxsackie virus can cause aseptic meningitis, and as I said before, about 90% of cases of viral meningitis are caused by Coxsackie or echovirus. Group A Coxsackie virus can cause a condition called hand, foot, and mouth syndrome. This is a condition that occurs in children. They usually start with a sore throat and then they develop oral vesicles, classically on their buccal mucosa and tongue. It's followed by a rash of small lesions on the hands, feet, and buttocks. And you'll notice I underlined the words hands and feet. And that's to remind you that this is one of the three rashes that can involve the hands and feet. Most infectious rashes spare the hands and feet, but three that don't are syphilis, Rocky Mountain spotted fever, and Coxsackie virus when it causes hand, foot, and mouth syndrome. Another Group A infection is called herp angina, and herp angina has a very high fever and painful mouth blisters. This also occurs in children, classically during the summer months. Now, both hand, foot, and mouth syndrome and herp angina can cause lesions inside the mouth. What's different is that herp angina generally has a very high fever. Sometimes kids get seizures because the fever is so high, and then herp angina is limited to the mouth. There won't be any rash, and it's also very painful, the lesions that are inside the throat. Finally, Group B Coxsackie virus is a classic cause of myocarditis and pericarditis. I talk about the symptoms of these conditions in the cardiology modules, but for our purposes here, just know that if they present you with a board question of a patient with myocarditis or pericarditis, Coxsackie virus is a very common cause. So on the left side of the screen here is a picture of a child with hand, foot, and mouth syndrome. You can see that there are lesions on the hand here. There are also lesions around the mouth, and there are sometimes lesions inside the mouth as well. On the right is a picture of a child with herp angina. So this child would have a very high fever and a very painful sore throat. And you can see inside the throat that there are lesions in the back of the throat. These can be macules, papules, or vesicles, and they can go through a progression as the child works through the disease. So back to our summary slide, we've now talked about the four families of naked RNA viruses. So there were the caliciviruses, which was basically just Norwalk virus, hepatitis E virus, the two reoviruses, rotavirus and coltivirus, and finally the 5 different picornaviruses that go by the pneumonic perch. Now what I'm going to do is move on and talk about this group of viruses right here. They all have a positive sense RNA genome and they are enveloped. So let's begin by talking about the coronavirus, and the word corona means crown, and it gets that name because this is what it looks like under the electron microscope. It has a halo around it that looks like a crown, and therefore it's called coronavirus. This is an envelope virus with a positive sense single-stranded RNA genome that is linear with a helical capsid, and this is the only RNA virus that is positive sense that has a helical capsid. All other positive sense RNA viruses have an icosahedral capsid. It's a common cause of an upper respiratory infection or the common cold. Now, the most common cause of the common cold is rhinovirus, but coronavirus can also cause this. It can also cause something called the severe acute respiratory syndrome, or SARS. So there was a worldwide outbreak of SARS in 2003 where patients developed a 1-week prodrome of fever, malaise, headache, and myalgias. Then they would develop cough and dyspnea, and sometimes it progressed to respiratory failure. This outbreak in 2003 resulted in a lot of people being quarantined and a lot of fear about the virus being spread around. Moving on, let's talk about the retroviruses. So these are envelope viruses with single-stranded RNA and a linear genome, and they use reverse transcriptase to convert their RNA into DNA, and then the DNA replicates in the nucleus. The most important retrovirus is HIV, and I have an entire separate module on HIV, but there's one other retrovirus you should know about, and that's called human T lymphotrophic virus, or HTLV. So HTLV is a diploid virus. It carries two identical strands of positive sense RNA, and the same is also true of HIV. Also, just like HIV, HTLV enters CD4 positive T cells, and then the RNA genome is reverse transcribed into DNA, and then the DNA product is integrated into the host cell genome. And all of this is the same as HIV, which is an easy way to remember the features of HTLV. What happens once HTLV infects T cells is that the T cells begin to proliferate and transform. So unlike HIV where the T cells die, in this case they become malignant. And the result is that you get a T cell leukemia lymphoma, which is a variant of non-Hodgkin's lymphoma. HTLV is endemic outside the US. There are places in the Caribbean and Africa and South America where up to 20% of people have antibodies to this virus. Many people who get infections in the United States share dirty needles with people who have immigrated from one of these countries. It's also sometimes transmitted by contaminated blood products or breastfeeding. The virus infects millions of people, but only a few develop leukemia, and it's relatively uncommon in the United States. The next family of viruses are the flaviviruses. These are all envelope viruses with a positive sense single-stranded RNA genome that's linear with an icosahedral capsid. Most of these viruses are mosquito illnesses that you get from a mosquito bite. The one exception is hepatitis C. It's a very unusual member of this family, and I talk about hepatitis C in detail in the module on viral hepatitis. What we'll do in the next 4 slides is talk about the 4 mosquito illnesses caused by flaviviruses, and those are yellow fever, dengue fever, St. Louis encephalitis, and West Nile virus. Yellow fever is caused by the yellow fever virus. This virus occurs predominantly outside of the United States in places like Africa and South America. The virus can live in monkeys, and it can become transmitted to humans by a mosquito bite of a mosquito called the Aedes mosquito. And viruses that are transmitted by a mosquito or tick bite are called arborviruses. This name is an acronym for the word arthropod-borne virus. Yellow fever virus infects the liver and makes people jaundiced. That's why it gets the name yellow. So they will have a very high fever, as the name implies. They often have a severe headache, and then they become jaundiced with a very high bilirubin level. The liver function tests become elevated in yellow fever, so the AST and ALT will be high, and often the AST is much higher than the ALT. This can be a severe and life-threatening infection. It can lead to hemorrhage, especially of the GI tract. Patients with yellow fever classically have black vomit. This is coffee ground vomit with blood in it. They can also have oozing from their gums. There's no specific treatment for it, and it has a very high mortality rate, and there is a vaccine available to prevent yellow fever, especially in travelers to countries where it's more common. There is a characteristic pathfinding in the liver of patients who have yellow fever. It's called a Councilman body. This is a picture of one right here. It's this pinkish eosinophilic inclusion seen in types of cells in the liver. Dengue fever is caused by the dengue fever virus. This is another infection that occurs predominantly outside of the United States in places like Asia and South America. Just like yellow fever, it's transmitted by a mosquito bite. Dengue fever is also an arborvirus infection. The easiest way to remember the symptoms of dengue fever is to remember its other name, which is breakbone fever. These patients will have symptoms as if they've broken multiple bones. They will be in extreme pain. It begins with fever and a headache, and then it classically develops into retroorbital pain, and then patients develop severe, and I'm underlining and capitalizing the word severe, muscle and joint pains. Many patients with viral infections have joint pains, but dengue fever is extremely severe and much worse than anything else you will see in a viral infection. There's also a maculopapular rash, and then it can rarely progress to hemorrhagic shock, and there's no specific therapy for this, just like with yellow fever. St. Louis encephalitis virus and West Nile virus are the next 2 flaviviruses, and they share many features in common. They are both transmitted by mosquito bites, so they are both arborviruses. Birds are the natural reservoir for both of these viruses, and both of these viruses can cause encephalitis. So people who contract an infection from one of these viruses develop fever and altered mental status. Sometimes they will also have meningitis symptoms like stiff neck and photophobia. Many people who are infected with these viruses are asymptomatic. Both of these viruses cause on the order of 10 to 100 cases per year in the United States. The St. Louis encephalitis virus is widely distributed in the Americas, and as I said before, just a few cases a year occur in the US, and sometimes there are outbreaks in the United States. West Nile virus is widely distributed across the globe. It gets its name from the Nile River in Africa. There have been outbreaks in the United States. The most important was in about 1999 when there were a couple of dozen cases in New York City. Our next family of viruses are called the toga viruses. These are envelope viruses with a positive sense single-stranded RNA genome that is linear and icosahedral, and a lot of people just remember that these viruses wear a toga to remind them that they are enveloped. Use that if you wish. There are three medically important viruses in this family. The first one is rubella, which is a childhood rash disease, and then there are two others that cause encephalitis, eastern equine encephalitis and western equine encephalitis. Rubella also goes by the name German measles or the 3-day measles. It is a childhood exanthem, which means a childhood rash. Children acquire a rubella infection by inhaling respiratory droplets from other children who are infected. Initially, they develop a mild fever and lymphadenopathy, and then they will get a characteristic maculopapular rash about 1 to 5 days after the fever. The lymphadenopathy classically occurs in the posterior cervical or posterior auricular area of the body, and you should remember this so that you can recognize it in board questions. Once children have been infected, they have lifelong immunity, so before there was a vaccine, every child would get rubella at some point and then they would never get it again. Nowadays, there is a vaccine available. There's no specific treatment for this illness. It's usually self-limited, and the vaccine is a live attenuated virus that is part of the MMR vaccination, which stands for measles, mumps, and rubella. The most dangerous consequence of a rubella virus infection is the congenital rubella syndrome, and this occurs when women who are pregnant develop a rubella infection. It's one of the torches infections that are dangerous during pregnancy. The mother acquires the infection via respiratory droplets, and a pregnant woman will develop rash, fever, and lymphadenopathy. The problem is that the virus will infect the fetus, and there's a classic triad of congenital abnormalities in the fetus. The fetus will have deafness, cataracts, and characteristic cardiac disease. One of the most common congenital heart defects in babies born with the congenital rubella syndrome is a patent ductus arteriosus, or PDA. These babies also sometimes have pulmonary artery stenosis, and there are many, many other congenital heart deformities reported in children who are born with the congenital rubella syndrome. These babies often also have a characteristic rash called the blueberry muffin syndrome or the blueberry muffin baby syndrome. These are petechiae and purpura found all over their body. In utero, extramedullary hematopoiesis occurs outside of the bone marrow in the dermis layer of the skin. This normally stops prior to birth, but if it persists, babies can get this blueberry muffin rash where they have these petechiae and purpura all over their body. Another thing to know is that babies will excrete the virus for months, and this is a public health hazard. So once one child is born with the congenital rubella syndrome, that child can potentially infect many others. You can make the diagnosis by finding IgM antibodies in the mother, which suggests a recent infection, and sometimes amniocentesis is done to look for evidence of the virus in the amniotic fluid. Let me pause here and mention newborn deafness. This is associated with two congenital infections, cytomegalovirus and the congenital rubella syndrome. Both of these infections also cause the blueberry muffin baby syndrome, so it can be difficult to tell them apart. But cytomegalovirus classically causes seizures and enlarged liver and spleen, whereas congenital rubella syndrome leads to cataracts and congenital heart disease. These are often confused by students, so make sure you can tell them apart for your board exams. The last two toga viruses are the eastern and western equine encephalitis viruses, and both of these viruses can cause encephalitis, as you can imagine from the name. Both of these viruses can also infect humans and horses. That's why they get the word equine in their title. They're both found in North America, and the reservoir for both viruses is birds. Don't get fooled by the word equine in the title and think that the reservoir is horses. That's not the case. It gets that name because the virus can infect horses, but the reservoir is birds. They're transmitted to humans by the bite of mosquitoes, and most infections are asymptomatic, but they can cause encephalitis and give symptoms like fever and mental status changes. And of all the mosquito-borne viruses that can cause encephalitis, the worst one is eastern equine encephalitis. People often call it triple E, and it's much feared because the encephalitis from this virus tends to be more severe than the others. So back to our overview slide, we began by going through all of the naked RNA viruses, and we just finished going through all of the positive sense envelope viruses, which included coronavirus, the retroviruses, the flaviviruses, and the toga viruses. So now what we're going to do is go through the negative sense viruses. All of the negative sense RNA viruses are helical, and all of the negative sense RNA viruses are enveloped, which makes their features fairly easy to remember. Let's begin by talking about the bunya viruses. These are enveloped viruses with a negative sense single-stranded RNA genome and a helical capsid. The bunyaviruses are a segmented virus family. Remember, the mnemonic for segmented viruses is BOR, and the B stands for bunyaviruses. They also have a circular genome. Remember, there are three families of RNA viruses with a circular genome. It goes by the mnemonic BAD, and the B stands for the bunyaviruses. The bunyaviruses are relatively rare causes of infection. There is one bunyavirus called the California encephalitis virus. This is another mosquito-borne virus that causes encephalitis, just like many others we've talked about in this module. One thing that's unusual about the California encephalitis virus is that its reservoir is rodents, not birds, as opposed to many others. And then there are a number of bunyaviruses which can cause hemorrhagic fever, which we'll talk about in a minute. They all have unusual names, like the Rift Valley fever virus, the Crimean Congo hemorrhagic fever virus, and hantavirus. Let me pause here and review the 5 RNA viruses that can cause encephalitis. These are all mosquito-borne arboviruses. The first 2 are members of the flavivirus family. Those are the St. Louis encephalitis virus and the West Nile virus. The next 2 are members of the toga virus family. Those are Eastern equine encephalitis and Western equine encephalitis viruses. And then finally, there's one member of the bunyavirus family, the California encephalitis virus, that can cause encephalitis. Usually the reservoir is birds, and then the infection gets transmitted by the bite of a mosquito. The one exception is California encephalitis virus, where the reservoir is rodents. Let's discuss hemorrhagic fever. Hemorrhagic fever is caused by one of several viruses. It is a viral infection, and it's always caused by an enveloped RNA viruses. These viruses live in animals, usually birds, and most are transmitted to humans either by a mosquito or tick bite, or sometimes from contact with infected animals. The initial symptoms are nonspecific, things like fever and headache and malaise. Often people have GI symptoms like vomiting or diarrhea. And then the reason these are serious infections is because hemorrhage can occur. So people can develop petechiae, large hematomas, and they can develop frank bleeding. And this can progress to respiratory failure, shock, and even death. There are 3 bunyaviruses that can cause hemorrhagic fever. The first one is called the Rift Valley fever virus. You get this in Eastern Africa when you get bit by a mosquito. You can also get it from coming into contact with animals that have been infected by mosquitoes. Another bunyavirus that causes hemorrhagic fever is called the Crimean Congo hemorrhagic fever virus. You also find this in East Africa, but you get this from the bite of a tick. You can also get it from coming into contact with livestock that have been infected by ticks. And then finally, hantavirus also occurs in Africa and places outside the United States. This virus lives in rodents like mice, and you get it from coming into contact with an infected rodent. Also, the virus is shed in the rodent's urine and feces and saliva, so if you consume food or water that's contaminated by rodents, you can get this infection. And hantavirus infection often progresses to have renal failure or respiratory failure. The next family of RNA viruses is the filovirus family. There are 2 important viruses in this family, the Ebola and Marburg viruses, both of which can cause hemorrhagic fever. These are both envelope viruses with a negative single-stranded RNA genome that is linear with a helical capsid, and these viruses are transmitted through contact with the body fluid from an infected person. Ebola is probably the most famous because there's been an outbreak in Africa since 2014, and a few of the cases have spread to the United States, and most of the people who have become infected have been exposed to other people who were infected. It's a highly contagious infection. It also has a very high fatality rate. The next family of viruses is the RNA virus family. These are envelope viruses with a negative sense single-stranded RNA genome and a helical capsid. They are segmented viruses. Recall that the mnemonic for segmented RNA viruses is BOR, and the letter A stands for RNA virus. They also have a circular genome. The mnemonic for circular genome RNA viruses is BAD, and the letter A here also stands for arenavirus. There are 2 viruses to know about in this family. The first one is the Lassa fever virus. This causes hemorrhagic fever. It's spread in the urine of infected rats. You can also contract this through close contact with infected persons. And then the second arenavirus is the lymphocytic choriomeningitis virus, or LCMV. And it has the word meningitis in its name to remind you that it is a rare cause of viral meningitis. This virus is shed by mice and rats in their saliva, urine, and feces, and it often infects children who are living in poor conditions in resource-poor countries. They are at high risk for exposure. Let me pause here and review all the different viruses we've discussed that can cause hemorrhagic fever. So there are 3 bunyaviruses: the Rift Valley fever virus, which you get from a mosquito bite, the Crimean Congo hemorrhagic fever virus, which you get from a tick bite, and the hantavirus, which lives in rodents and you get from exposure to infected rodents. The 2 filoviruses, Ebola and Marburg, can both cause hemorrhagic fever. You contract these by exposure to infected persons. There's one RNA virus that can cause hemorrhagic fever. That's the Lassa fever virus. And remember, it lives in rats, and the rats shed this in their urine. And then finally, the two flaviviruses, yellow fever virus and dengue fever virus, can sometimes progress to a hemorrhagic fever type picture, although that is not the classic syndrome caused by either virus. Next family of viruses are the rhabdoviruses. These are all envelope viruses with a negative sense single-stranded RNA genome that is linear with a helical capsid. And there are several species of rhabdoviruses, and they all cause the clinical syndrome of rabies. So rabies is an infection that you get from the bite of a rabid animal. The rabies virus is found in bats and raccoons and skunks and coyotes and wolves. The classic transmission is from a dog bite, although in reality dog bites are only responsible for a small number of rabies infections. So after you get bitten by an infected animal, there's an incubation period of about 1 to 3 months. And then people develop a prodrome that's relatively nonspecific, like fever and malaise, sometimes nausea and vomiting. And then the classic rabies symptoms occur from infection of the central nervous system. So patients will develop encephalitis with confusion and delirium. They classically get painful spasms of their pharynx. This makes them afraid of water because of how much it hurts to swallow. They will also be agitated, and they will salivate frequently. And this is all from those pharyngeal spasms related to infection of the central nervous system. It then progresses to paralysis and coma, and it's a very serious infection. It's almost always fatal. There is a pathfinding of rabies infection that's high yield to know for step 1, and it's called a Negri body. So the virus has what's called a bullet-shaped envelope, and this forms Negri bodies in neurons or Purkinje cells that are infected. If you look at this neuron in this picture right here, you see these dark inclusions inside the neuron. These are the Negri bodies, and these are evidence of rabies virus infection of the central nervous system. It's also high yield to know that this virus likes to bind to acetylcholine receptors on peripheral nerves, and then it gets into the nerves and migrates to the central nervous system. So because the disease is so dangerous and so often fatal, it's very important to properly manage patients after a bite where they might be infected. So you should suspect that someone may be infected with rabies if they get bitten by a wild animal or if they get exposed to bats. The first thing you need to do is clean any bite wounds carefully. That's obvious. And then you administer the rabies vaccine, which is an inactivated virus vaccine. Now, it will take time for the body to generate an immune response. So in addition to the vaccine, you administer something called rabies immune globulin, which provides antibodies that are protective until antibodies get generated from the vaccine. The next family of RNA viruses are the orthomyxoviruses. The most important member of this family is the influenza virus. These are envelope viruses with a negative sense single-stranded RNA genome that is linear and has a helical capsid. And the orthomyxoviruses are segmented. Remember, the mnemonic for segmented viruses is BOR, and the letter O stands for orthomyxovirus. The influenza virus causes an acute respiratory illness that most people call the flu. It occurs most often in the winter months, and it is transmitted by respiratory secretion. So an infected person coughs or sneezes and passes this virus on to somebody else. Initially, people get a nonspecific syndrome of fever and headache, myalgias and malaise. Then they develop a cough and sore throat and runny nose. It's usually self-limited, and improvement occurs after a few days or weeks. There are rare complications of influenza, however, that can be very serious. So patients can develop a pneumonia. It can either be a viral pneumonia from the virus itself or a secondary bacterial pneumonia. These complications are more common in the elderly, so you can imagine that when this illness occurs in the winter months, many elderly people get very sick and often are hospitalized for infection with influenza virus. Of the bacteria that can cause a secondary infection on top of the viral infection, the most common is strep pneumonia, and Staph aureus is the second most common. Influenza has several subtypes, either A, B, or C. Influenza A is the most common, and influenza A is the type that causes major worldwide outbreaks and pandemics. We'll talk more about that in a minute. Influenza B can cause outbreaks, and influenza C usually causes a milder disease and doesn't cause outbreaks. Influenza virus has two key envelope glycoproteins that you need to know about. The first one is called hemagglutinin, and this glycoprotein binds to cells and helps the virus enter into cells. The second influenza glycoprotein is called neuraminidase, and this removes sialic acid from glycoproteins, and this is an essential step for the virus to be able to exit the cells. And there are some influenza drugs that inhibit the neuraminidase enzyme, and this blocks the ability of the virus to get out of cells. And one important thing to remember about influenza that is relatively unusual is that it replicates in the nucleus, not in the cytoplasm. Most RNA viruses replicate in the cytoplasm. The influenza virus periodically develops slight changes in the glycoproteins hemagglutinin and neuraminidase, and when it does, this changes the antigenicity of the virus and it allows it to evade the immune system. Sometimes when this happens, you get what are called antigenic drifts. These are when minor changes in hemagglutinin and neuraminidase occur. It's due to random mutation in the structure of these glycoproteins. This varies from year to year, and that's why people who get pneumonia one year may not be immune the next year. And these are called epidemics, these outbreaks that occur every year in the winter months. Rarely, the virus will have a major structural change in its hemagglutinin or neuraminidase glycoproteins, and this is called an antigenic shift, not a drift, but a shift. Recall that the genome of influenza is segmented. This means that if two viruses infect the same cell, they can reassort and develop a new virus that has a completely different genome and has a completely different structure of hemagglutinin and neuraminidase. And this often occurs when animal and human viruses infect the same cell. There are versions of influenza that are found in animals, and if one of those gets into a cell and a human virus does as well, then the two segmented genomes will reassort and you will get a new virus that's completely different than anything we've seen before. When this happens, you get major outbreaks around the world of influenza infection. One of the famous ones happened in the United States in 1918, and millions of people died. This can also sometimes occur in other segmented viruses, although it's best described for influenza virus. So you should think of reassortment and antigenic shift in board questions when they ask you about viruses like bunyaviruses, arenavirus, orthomyxovirus, or reoviruses. Since all of these are segmented, they can potentially undergo this reassortment and antigenic shift. Any of you who've received a flu shot know that there is a vaccine available for the influenza virus. It's grown in eggs. Each year, the World Health Organization recommends which strains should be grown in culture. They monitor the types of viruses causing infection and try to predict the strains that will cause infection in a given set of winter months. The virus is grown in eggs and then it is killed, and it's available each fall to try and prevent the winter flu. There is also a nasal spray version. Most people get a shot of this killed virus vaccine, but there is a nasal spray vaccine available. It's a live temperature-sensitive mutant. It'll replicate in the nose, not in the lungs, and this is sometimes used for children who don't want to get the injection. It can only be used in limited circumstances. It's not recommended for adults over the age of 50, and most people receive the injectable killed virus vaccine. Our last family of RNA viruses are the paramyxoviruses. These are all enveloped viruses. They have a negative single-stranded RNA genome and a helical capsid. They all cause diseases in children, and a unique feature of all the paramyxoviruses is the presence of the F protein on their surface. F stands for fusion, and that's because this protein helps the virus fuse with respiratory epithelial cells. There is a monoclonal antibody against the F protein. It's called palivizumab, and this is sometimes used to treat one member of the paramyxovirus family, the respiratory syncytial virus infection that occurs in children. So there are 4 members of the paramyxovirus family that cause infection, and like I said before, these all cause infection in children. The first one is called the parainfluenza virus, and this causes croup. So croup looks just like an upper respiratory infection in a child. The child will have sore throat and runny nose, but what's unique about croup is that they develop a barking cough. It sounds like a seal. If you've ever seen a kid with croup, it is very easy to recognize. And the reason they have this barking cough is because of the infection involving the oropharynx and the throat, and it can potentially lead to respiratory distress, and sometimes children who have the barking cough of croup are treated with steroids to knock down the inflammation in the back of the throat. Otherwise, this is a self-limited infection. It's just treated like any kid who has a cold. RSV is the respiratory syncytial virus. This causes a viral respiratory infection in infants. I talk about this in the pulmonary modules. There are 2 treatments that can be used. One is an antiviral agent called ribavirin, and one is the monoclonal antibody I mentioned on the last slide. And then the last 2 paramyxovirus infections are measles and mumps, which we'll talk about in more detail now. The measles virus causes measles. It's also called rubeola. It has a classic triad of symptoms that goes by the mnemonic, the 3 C's. These include cough, coryza, which is a runny nose, and conjunctivitis, which is inflammation of the eyes. There is a classic maculopapular rash that starts at the head and spreads to the feet. I'll show you a picture of that in a minute. And then another classic finding is the presence of Koplik spots. These are small white lesions inside the mouth. Usually measles is self-limited, but occasionally it can progress to cause some rare complications. One of these is encephalitis. Another rare complication is something called subacute sclerosing panencephalitis, or SSPE. This is a complication that occurs years after someone has had the measles infection. It's the result of permanent alterations to the brain. So patients with SSPE develop personality changes, odd behavior, and dementia, sometimes at a very young age. And then finally, measles can occasionally cause giant cell pneumonia. This occurs when people who are immunocompromised get infected with the virus, and they will have a pneumonia syndrome with multinucleated giant cells seen in the lung tissue. On the left side of the screen here is a picture of a child with the maculopapular rash of measles, and on the right side are a picture of Koplik spots. Those are these white spots in the back of the throat. Often the infection begins with a high fever, and one of the first diagnostic clues is the presence of Koplik spots. These will often develop before the rash, and then after the Koplik spots have been present for a day or two, that's when the rash typically develops. Some of you may be aware that in 2014 there were outbreaks of measles in the United States among unvaccinated children. These were children whose parents had declined vaccination for a variety of reasons. One item of concern during these outbreaks was that the measles can spread to vaccinated children. Even though they've been vaccinated, the vaccine is only 95% effective. This means 5% of children are not protected despite vaccination. The diagnosis of a measles infection is often made clinically, but the test of choice if you want to send a blood test is blood for the measles IgM antibody. Importantly, it takes a few days for this to be positive, so it's more sensitive if you test after the child's had symptoms for 3 or 4 days. There are a couple of possible therapies you can use to treat a measles infection. Vitamin A has been associated with reduced severity of infection in children in developing countries. It's often administered to people who have measles. And then ribavirin has been shown in vitro to be effective against the virus. Whether or not it works clinically is unknown. There aren't any clinical trials, but it is often tried in an attempt to limit the symptoms of infection. The mumps virus causes mumps, and the name rhymes with the word bumps, and that can remind you that this causes bumps or swellings in several places of the body. It begins as a prodrome that is fairly nonspecific, including fever and malaise and headache and myalgias. The two characteristic findings are parotitis and orchitis. So parotitis is inflammation of the parotid glands, which gives facial swelling. This is a picture of a child with parotitis, and you can see how swollen his face is here, and this is fairly classic for mumps. Orchitis occurs in boys. It's swelling of the testes. These children will have testicular pain and scrotal swelling, and a serious consequence is that they can be left sterile after mumps resolves. And then you should also know that mumps can involve the central nervous system and cause aseptic meningitis. The MMR vaccine is given to children to prevent measles, mumps, and rubella. It is a collection of 3 live attenuated viral vaccines. It's usually given after 1 year of age because prior to a year it's less effective because maternal antibodies may still be present that will kill the attenuated virus in the vaccine. You should also know that a live attenuated vaccine is required for vaccinating people against measles and mumps. That's because these two viruses form what's called syncytia. So syncytia are when infected cells clump together, and it allows the virus to move from cell to cell directly. As a result, measles and mumps viruses are usually not exposed to plasma, so antibodies aren't very effective. In order to vaccinate against this, you need to generate a vigorous cell-mediated response to infection. And in general, live attenuated viruses are more potent at generating a cell-mediated response to infection. Killed virus vaccines tend to generate more antibodies and less cell-mediated response. So you have to use a live attenuated virus vaccine in order to protect against measles and mumps for this reason. So I'll finish this module by reviewing the 5 childhood red rashes that you should be able to recognize in board question stems. The first one is rubella virus infection, which is also called German measles. This is a maculopapular rash that starts at the head and spreads to the feet, and it classically has posterior auricular lymphadenopathy, which will be swelling of the lymph glands behind the ears. Measles is also called rubeola. It causes a maculopapular rash from the head to the feet just like rubella. What's unique about measles is that it will have the 3 C's of cough, coryza, and conjunctivitis, and also the Koplik spots in the back of the throat are unique to measles infection. HHV6 is a DNA virus that causes roseola. This is a fever that breaks and then results in a maculopapular rash that starts in the neck and trunk and spreads outward to the face and limbs. This commonly occurs in infants and it can lead to seizures. Parvovirus B19 is also a DNA virus, and this causes the slap cheek rash. It's very unique. And then finally, strep pyogenes is a bacteria that causes scarlet fever. This will always begin with a sore throat, especially in a board question. It will progress to a sandpaper-like red rash that starts in the head and neck and then covers the trunk. And that concludes our module on RNA viruses.